Good evening, everyone.
Good evening.
How are you, Mia?
Hey, Fran. What's going on?
I am not doing well. I'm not doing well.
Having a
I can.
long day?
Not really. One of my work colleagues died on Tuesday.
Oh,
They
so sorry to hear that.
they took him to the hospital on Monday and he died Tuesday.
Wow.
So our office, we are not doing well. We had EAP today, counseling session, and that made us feel even worse because everybody had to be talking.
Right.
Yeah, can you give me 1 minute, please? Someone is at my door.
Oh, sure, no problem.
Oh, okay, thank you much for your patience. It's now 7:03. We will start the meeting officially at 7:05. I would just like to give people a chance. Good night. I don't want to, is it Carnegie? I don't want to butcher.
Very good, very good. Cornigan, yes, that is correct. Thank you. Good night, everyone.
Good night, and Barbara Lindsay, and Karima, how are you?
Good night.
Good night, everybody.
Good night, yeah. Sometimes when you tend to wonder, one of my work colleagues asked, why is it that all the good people die? You know?
Yeah.
And this guy was just such a wonderful person, such a great, respectable, great co-worker, such a joy. Sometimes they say that women, when they walk into a room and they have this smile, they say, oh, this woman this lady would walk in the room and she would just brighten up the place. And he was like that. When he walked, it doesn't matter how bad a day you are having. You walk into the office and you're having a bad day, and he heard the door open and he will walk out of his office to greet you. And his smile alone, would just cheer you up. Just such a wonderful human being. Wonderful human being. But God knows best. I might take Mia, the caption, it takes the attendance as well, or would I have to write it? Because Melissa wouldn't be able to make it.
No, I got it. No worries.
Okay. Appreciate it. Okay, it's now 7:05. The meeting is called to order at 7:05. I just want to say good night to each and every one of you. Welcome to you, if there are persons here who are joining us for the very first time. Welcome on this platform, the Health and Social Services Committee. Something I always say, whenever you come on this platform, you become family. You're not a stranger. When you are here, you are family. So I just want to say welcome. And I just want to ask one question across the board, and it's for everyone. In your outing today, maybe some of you was sitting in your office, some of you were on the street, whatever that you did throughout the course of the day, what's the one thing that you could change if you had a chance to? The one thing you could have changed for the day. Good night, my sister Enid.
How are you?
I'm okay. I'm trying. I'm okay. The one thing that you can change throughout the course of the day, whatever that you might have done, since you encountered, whatever it is, that one thing when you think back that you would love to change if you had a chance to.
I guess I can go first. I use my lunch hour to take a walk. I wish I had a little bit more time. Sometimes you get walking, you get going, and then you look at the time and you don't realize how much ground you covered and how much time has passed. So now that I think that it's getting nicer, that's something I'll do more often. Just walk around.
Yeah. Thank you, Mia.
Sure.
I'll go next. This is Barbara. I didn't go outside today. I had laundry duties to do, house duties, but I heard it was decent. I wish I had at least taken a walk. I usually go out, but today was laundry day. I'm going on a trip next week, so I had to get all that out the way.
Be safe on your trip.
Thank you.
Go ahead, Rhonda.
My name is Rhonda, and one thing I would change is taking time out to have lunch. I brought my lunch to work today, but of course, the day got away from me and my lunch is still at work.
Wow. Wow.
Taking time out and being conscious about doing that.
Hi, Tracy. The question on the floor as the icebreaker throughout the course of the day, if there's one thing that if you had a chance so that you could change, what would it be? So the floor is open. We've heard from Mia and from Rhonda. So anyone else who want to respond, who want to speak?
I could go.
Go ahead, Karima.
Good night, everybody. This is Karima again. If I could have changed one thing today, it would be, I wish I didn't have to work today, so I could have got to go to the park or enjoy being outside. It's rare to get weather this warm earlier today until 3-4 p.m. And I wish I had wore my hair tied back because it was also super windy, and with it blowing back and forth, my hair kind of looked like I've been hit by a hurricane and a tornado.
Oh, wow. Thank you, Karima. Next person. I think I'll go while the others are still thinking. For me, I just shared for some of you who are just coming in. For me, if I could change one thing, the pain that I am feeling, and I have a work to do, so I have to sit here with you guys, and be strong. But if I could change anything, the pain that I have in my heart in the pit of my stomach, the heartache that I'm feeling. I would give anything to change that. And for those of you who are just coming in, one of my work colleagues, he was taken to the hospital on Monday and he died yesterday. So it is really hard, really hard on the staff and myself. And I'm tired and sleepy, you know. But yeah, I would really change that feeling that I have. And I try to shake it off, but it's just not going. So that's it for me. So we've heard from 4 persons, 5 persons. So we have yet to hear from Jackie, Enid, and Tracy. As
I'll go next. I think if I could change anything today, it would have stopped earlier this morning when I was in such a rush and really started a daily meditation, which is what I love to start my day with because it sets me on a really nice trajectory. I'm not so flustered. And, those are the things that we think don't matter, but they really do matter once your day starts getting hectic. And I didn't have that centering. It will not happen tomorrow. I'll make sure that I get up early enough to start my day in that centered space.
thank you.
I resonate with that a lot. I think for me, I would have spent time when I didn't have patients, when my kids were not home, when they were still at school, even if it was 5 minutes in the silence with my own thoughts, because having that time to regroup, it organizes everything in a very different way. And I find I have to be really intentional about that time, and I could have been more so today.
Okay, Miss Love.
Hi, good evening, everyone. Mine is kind of simple. I wish I had done my dishes last night so I wouldn't have to do them tonight after this meeting. That's it. That's the only thing I would change, I think.
Okay. All right. Okay. So, all right. Warren, are you there?
Yes, I am.
Okay. We haven't heard your voice.
So the question is, what would I change today?
If you had a chance to change anything for the day, what would it be?
Obviously that I didn't see you till tonight. Yeah. No, actually,
Thank you for put a smile on my face.
let me think. I really wouldn't change anything. I had a good day.
Okay. Thank you so much, everyone, for participating in the icebreaker. So we'll go right into our introductions. My name is Francisca Leopold, Chair for the Health and Social Services Committee, and member of the Community Board 9. Moving to Mia and pass it on, Mia, as we go.
Hi, good evening, everyone. My name is Mia Hilton. I am the Assistant District Manager for CB9 and happy to be here. It's been a while since I've been at Friends, covering Friends meeting. So happy to be back. Good to see everyone. Hi, Jackie.
So since you called Jackie, we'll just pass it right back to Jackie.
Perfect.
Good job, Mia. Thanks. My name is Jackie Love. I am the founder of Grandma's Hands and the Director of Senior Services and Support for Quincy Senior Residences. Karima.
Hi, everybody. My name is Karima. I am a fellow CB9 member, and a recent alumna of SUNY Downstate. I graduated with my master's in public health back in December. Thank you. Thanks, Fran. I appreciate it. I think right now I wanna do something that allows me to leave a positive impact in the community. I don't know what it is yet, but I'll let you know when I find it.
Popcorn somebody else. Okay, I guess she didn't call anyone. Okay, anybody else? And just jump in.
Hi, my name is Enid Dillard. I'm the Director of Marketing and Public Affairs at Kingsbrook at One Brooklyn Health, and it's my pleasure to be here with everyone tonight.
Thank you. Go ahead, Rhonda.
Hi, my name is Rhonda. I am the Assistant Principal of Ebbetsfield Middle School. I'm located in Crown Heights, and it's my pleasure to be here this evening.
Thank you. Thank you so much. Thank you so much for coming. I'll be coming back to you, Tracy.
I'm Tracy Seitzinger. I'm a clinical psychologist in PLG, part of Flatbush, and I'm starting the New York Center for Community Psychoanalysis, which is going to be a nonprofit community-based clinic here. And I've been coming to these meetings for a few times now, especially interested in the wellness fair, and you're so welcoming. And it's been a lovely group of people every time I've been here. So I feel very glad to be here. And my daughter is having a play date right now, and I will have to exit for a moment to release her friend to her mother. So apologies, and I'll be right back as soon as I have to do that.
No problem, no problem. Thank you so much. Barbara? Okay, Barbara, maybe she's away from her phone. Warren?
Hi, I'm Warren. I am the first vice chair of CB9, as well as some other health-related activities. And I'm just happy to be with a bunch of people who want to move things forward.
Thanks everyone so much for the introduction. And just before I call on Warren to give us some info on the wellness fair, I just want to ask Ms. Rhonda is welcome. Thank you for coming. How did someone invite you, or just give us a little bit of you being with us today?
In my building, there is a charter school, and one of the directors of the charter school attends the Community 9 meeting, and we are in the process of planning a community-based town hall. And the topic of our town hall is mental health, protecting your mental health through the pandemic. And because she attended the community board meeting, she said that you do have a health and social services committee, and that maybe we can present our town hall to you, and maybe someone could come and serve as a panelist, or just invite you all to just be a part of the community town hall event that is taking place on April 12th. So that's how I came to this meeting.
Thank you. Thank you. So I'm gonna allow you to give us a little bit more, but Barbara, I know that you unmuted yourself to introduce.
Yes, I'm sorry, I was having problems before. I apologize. Well, I'm a retired my retired childcare provider, home childcare provider, and I live in Ebbetsfield, and this is my second meeting. I worked with our president here to basically do pantries and give out meals to the seniors. And, you know, basically that's what I'm involved with that a lot. So.
Okay. Yes, and welcome, Rhonda. And I'm always happy to hear persons working with seniors and trying to do giving back to the community, especially to our seniors and our young people. And when it comes to mental health and all the other things that are really affecting our community, there is so much happening, and then I don't think that enough is being done. So I'm very happy with the interest each and every one of you have in really giving back to the community and offering the service. Before I call on you, Miss, I'll say Rhonda, Warren, can you give us a little bit on our welfare, wellness fair place? Whatever information that you have with the dates and everything.
Definitely. So for everybody knows, CB9 has had individual exhibitions or fairs or whatever. And what we were thinking this year is to bring them all together in order to have an impact on the community. So whether it's economic development or health or education or youth services or public safety, we were looking for a way to join everything together. And I just want to say that the health fair, which I was honored to participate in last year, was just excellent. So what we're looking to do is not to dilute anybody's work and fairs and things that they've developed in the past, but to put them all together. So we tentatively have decided on a date. I can't release that date, not because of secrets, but because we need permits. And we're looking to have it in Prospect Park by Lincoln Avenue. As you enter the park to the left and the right, there's a lot of space there. But we can't confirm everything until we have a permit. There's a couple of other sites under discussion, but personally, in my own opinion, I think that Prospect Park is the best place for the most, as I say, eyeballs to see what's going on. And the one thing I do want to say is that I just hope that we can work together to have the health components of this event as great as it was last year, because I was just honored to be a part of that. So thank you.
Thank you very much, Warren. Thank you so much. I just lost my pen. Sorry. I lost my agenda. Okay, so whilst I'm trying to bring back up my agenda, Miss Rhonda, can you give us a little bit more as to what you're looking to do, your planning, and what you would like how can we assist you, the committee and the board as on a whole? You're muted.
Sorry about that. We're looking to just invite the parents from the 3 schools in the building. There is an elementary school, a middle school, and of course the charter school, which is the middle school as well, and members of the community, just to have an open discussion about mental health. We had a lot of families affected by the pandemic. We had a lot of students lose parents, grandparents, sisters and brothers due to the pandemic. We know that there's a lot of food insecurity. We have had students as well as their family members test positive for COVID. We had several students who had to be out of school for, a period of time. And now with the uncertainty of the mask mandate, what is going to happen with that? There's a lot of anxiety in the community, and I know that people are suffering. There's a lot of stress that they're going through. People are losing jobs. So we just want to provide a platform for discussion and maybe provide some resources to families to support them through this time. And so hopefully, since your organization is a health and social service committee, maybe there's someone on the committee that would be able to come and just be part of the panel, share some resources to support the members of the community.
Well, I'm so happy with you being here. We have Tracy with us, we have Miss Love, we have Enid. As a matter of fact, everyone here, brings something of a difference, but it would impact the community on a whole, on different levels. So I'm very happy that you are here, because on past discussions that we've had, we spoke about children, and I'm very concerned about our children, especially just as you mentioned, children who've lost their loved ones. They lost both parents, and then they were confined in the home, doing the work virtually. They were not able to go outside, so they were suffering both ways. And then really and truly, I have been concerned when it comes to the mental health. I have been concerned about that, not only for the children, for the parents as well, and even for our seniors as well, because many of our seniors, during COVID, never wanted to venture out at all. They never want to leave the home, and even now we have seniors who are still they're still at home. Myself with Warren, we can provide persons to come in to speak to you. Then we also have Ms. Dillard from Kingsbrook Hospital, who would be Kingsbrook Jewish, who would be able to provide resources. So we all here can work with you. It's a chain, and the links are very strong. So we can work together, and I know that Tracy would be able to. Tracy, I'll just let you give an input based on what Rhonda just said before I go on.
Oh, thank you. One of the things that I had mentioned to Francisca about the wellness fair was the opportunity to have different groups, like you're saying, in focus groups, just coming together and speaking their experiences around a certain topic. And I think especially around the effects of mental health, on their mental health, of everything around COVID, is, to anticipate that there will be all of the things that you're talking about that come up, but also to see what they're able to say that you didn't anticipate, and that they're able to speak in that space together. And I just think that it's a wonderful thing you're holding that space, because that's what's needed.
Mhm, mhm.
And I think that I know I'm not sure if you're only targeting the children, but I think we need to look at the parents as well, or the the caregivers as well,
Right.
because because they're impacted as well. And then I think that looking at what you want to do, it won't be just a one-time shot. It would be something that we can have different series. Yeah, and that's what I'm looking at.
Yes. No,
Yeah,
it's for
because
everyone, the entire family unit, right? Everyone in the community.
yeah, because my thing about is, usually when we're having, especially when we're dealing with children, I think that most likely the past 2 years would more or less think to do virtual, but I think now we may want to do something in person. And then I think that I'm proposing that if you would do the children separately from the adults, and so then, because sometimes you find that children are more open when they are with persons that they don't really, know personally, or their parents, they're able to talk, and just pull out their feeling out there. But if they are with the caregivers, their parents, or whoever who has a close relationship with them, they kind of, stifle everything in. So I think that we could look at doing a session with the children, and then you can also have a session with the parents and the children, but we can also have a session with children and the parents, and then you can have a session with everybody together. Yeah.
I like that idea. At this time, though, until the mayor lifts the ban and we see what's going on with COVID, we will have to hold it virtually for now.
Okay.
Because we can't invite people into the school, with the whole vaccination thing, and they have to prove a
Right.
vaccination and things like that. So if you could join this first meeting virtually, and as things open up, we can have, monthly meetings, like you said, a series, that we would be open to that. providing just support and resources to the parents so they would be able to help themselves, and then helping themselves, they're able to support their children through this process.
Because the hospitals said that they have the services that the hospitals are offering. Then we have outside of the hospitals, we have the clinics. We have Tracy who, you know, just opened her business and they're looking to work with the community persons coming in. So this is a great thing. I really applaud you for, you know, looking into that because it is very, very important. Karima, you have your hand up, you go ahead.
Okay, hello everybody again.
Mm.
In response to what Rhonda said, I believe she is right regarding holding this session event for the community regarding mental health, because I can honestly tell you that this COVID pandemic has taken a very, very big toll on everybody, adults, kids, grandma, grandpa, mother, father, aunt, uncle, everybody. I work for New York City Health and Hospitals Test and Trace, where we used to be doing contract tracing, where we follow up with the folks who test positive and their families and provide resources such as food delivery, medicine delivery, take home COVID kits, etc. there. And some of the stories of the cases I have gotten has been very jarring and dark. I remember I had a case a couple months ago that I was still in the office space, not out in the community now, that I had a principal from a school called in to report a student who she suspected may have had COVID. And she knows the mom, but unfortunately, what she also disclosed to me was that the student just lost their father 2-3 weeks before that, and that student is only in the 5th grade.
Mhm.
It took me a second to get myself together, because obviously that triggered me a bit, being I lost my parent as an adult. I wasn't a child, but it still had the same effect. Imagine if I was also in elementary 5th grade as well. And a lot of families that this vaccine mandate, a lot of them are losing their jobs because being out for even a few weeks, they're behind on bills, rent, gas, everything, and it doesn't really cover that. I did hear in the news on my end of things, however, that the mayor is ending the vaccine mandate in the schools and businesses and stuff sometime this month. I don't know if it already kicked in or not, but I did hear that they were ending that altogether.
Tentatively on Monday.
Yeah. So I do think it's a very good idea to have this there. I by all means do it. And I also agree with what Fran said, having separate sessions for both separate for the parents and the kids, and then having them together, because the kids has so many things going on and how they're feeling. They may not feel free to express them with their parents around, but around other kids, they may feel more comfortable to open up. Yeah, that's my that's all I'd had to say about that.
Thank you so much, Karima. Before I say anything else, anybody would like to make any comments based on this discussion? Okay. Rhonda, so I'm assuming that you and your team would have met and discussed as to what you're looking to do, right?
Yes. We're in
Or
the
you're still in the
process.
process?
We're still in
You're
the
still in the
process of planning and, getting together our panelists and developing questions and the outline. We wanted to also give students an opportunity, just a few students from each school, an opportunity to talk about their experiences through the pandemic, how it has affected them, as a springboard to start the conversation. The event that we had last year was around COVID and safety in the community, because there's a lot of things going on in terms of violence in the community. And we also had the COVID pandemic. And it turned out very well. And the way it was set up last year, we had developed some questions and we sent the question to all of the panelists. And then we had a moderator just pose questions to each panelist. But because I think this year should be a little bit different, not that we can't have questions, but just having conversations openly about mental health and stress, I think it would be more beneficial than just posing questions, like a question and answer. So I think, whoever is part of the panel, if anyone here wants to be a part of the panel, and just talking about what mental health is, how we can protect our mental health, any resources that you have, what mental health looks like, what parents can do to support their child at home, how children can support themselves, different triggers that may just, have you go into a depressive state or anything like that.
Yeah, because also we want to look at bring awareness to the parents as well. They could see the signs when there's a change in them, because sometimes if you have your child who are accustomed of being inside, and then all of a sudden the child just wants to stay indoors, so you have to see the different signs as to the changes. And we also, I don't know if you did that, because in our discussion, we spoke about dealing with bullying and suicide as well. So I don't know if it's something that you also want to be part of the discussion, because it affects children's psyche as well. It affects their mental health as well when it comes to bullying and stuff like that. So I don't know if you wanted to be part of this discussion or if you want to deal with it at a later time. But I think it is something, especially dealing with the kids, it is something that we should parents have to be aware. They have to look, because a lot of parents, I was having a word with someone, and one of my children and one of my Bible class kids from church, and I try to get as much information and make the kids feel comfortable. They know, hey, I can talk, they can come to me and talk. And then I put it out there and I asked the child, how you doing? And then she said to me, I'm being bullied in school from grade 2 to grade 7. I haven't been bullied, and now it's worse. And the thing with it is that she said, I am not, I'm having difficulties at home and in school. And it's bad when a child, they're having difficulties, they're going through all those things in school, and when they get home, they have no one to talk to. And they're asking her, what's the issue? And she's like, okay, my mom have 2 younger kids. She's the eldest. And she said all the attention goes to the younger kids. So when she tried to talk to the father, and it's a girl, and she tried to talk to the father said, toughen up. What happened? They never take the time to sit down to listen to her as to what she have to say, and we were very concerned for her last week, but we said, have you ever thought of hurting yourself? She said, So we question her, and then she says, no, but it's just that she's at that place that she feels neglected, and it affects children. And then we have something that we have, especially in the Black community, and parents who are coming from the Caribbean, and the men, they always think that boys, especially boys, they have to toughen up and be a man if they are being bullied and stuff like that. So I'm very happy that for the group we have here, and for the work that we will do together for the community. Before I move on, any questions, any comments? Rhonda, I'm going to give you my number so you can call me so we can talk some more. And if we meet the first Thursday of every month, but if we are planning a program, if we are planning something, we have to meet because you cannot wait at the end of the month to meet. So you got to meet at least once a week, you know, to make sure that you have all your information and get everything done before the time. So we can always meet, and then we have a great group. When we were planning the wellness fair last year, we met, you know, we chose a day in the week that we would meet, and we would meet and discuss. Some persons couldn't make it each meeting, but you know, whoever could have been there, they were there and the work was done. And as Warren said earlier on, it was a great event. So anything that we're doing and we're collaborating with you, we can meet once a week with you, with your team, so that we could, even though it's a virtual affair, but it's going to be a great one. So before I move on, any questions? Anyone have anything to say to Rhonda? Okay. All right, so we're gonna move on. It's already 7:41, and Miss Love, I had a few items on the agenda, but I'm going to skip because based on what you want to do, I wanted to discuss our plans coming up for the next for the quarter, but it looks like you are our plans, so I don't necessarily have to go into discussing what plans that we're putting the. So only two other things that I need to discuss, but I'm going to give the floor to Miss Love now because she has this initiative coming up that we will be working with her. So Miss Love, the floor is yours.
Hi again, everyone. I had the opportunity to present on behalf of Grandma's Hands to the board of directors at Crown Gardens, which is right across the street from CB9. During the pandemic, we were doing a lot of food distribution there every Friday from May 2020 to September, October 2020. And what I noticed was that there wasn't, too much going on over there. So I, made a couple of calls to see how we could continue to support the senior subgroup that lives in that building. There are about 243 units there, and just under 100 of them are seniors. So, you can't just go in that building and do anything. You have to present to the board, and then they take a vote on it and so forth. So I presented to Ms. Cleveland. She's the board president. And the presentation simply was to do a food distribution, right? So it was approved, and we're gonna do that on Wednesday, March 16th. We're still ironing out the time for it, but it's gonna be Wednesday, March 16th. But what I did learn is that they used to have a lot of senior programming there. They don't have that anymore. So I asked, if we could participate in revitalizing the senior activities in collaboration, obviously, with CB9, Grandma's Hands, and some of our other health and wellness community partners. So I haven't gotten a final response on the long term, but they are open to doing some things and having us come in to assist in getting the seniors active again. So we were talking about third Fridays, well, doing the activities on a Friday, but third Fridays is an absolute, because that is senior cinema at BAM. So we could arrange for NYPD Community Affairs to come and pick them up, take them down to BAM, and then bring them back, right? And then the remaining 4 days would either be a pantry day and then a movie night or game night or something. We'll figure out, what that's going to look like moving forward, should they, firmly decide that this is something that they want to restore, right? But that's pretty much what's going on that part. And I don't know, Mia, you might have heard about this. The PFRED program through HRA, that was providing that's pandemic food relief. That program was just recently cut. And they're working on, so there's no food. Nobody's been getting any deliveries all week. And they are working on trying to restore. I had to get crafty and throw a couple of, CCs into the council members, so I could make sure that I got an answer from HRA, because I needed to know why it was cut, what's the problem, what's the timeline looking like for it to be restored. So they did respond, and they're saying they're working, diligently to get it back restored. But there was a shortage. They pretty much ran out of food, so they just got to wait to kind of stock up again, and then they're going to start sending those food pallets out to everybody again. But just in my conversations, in my small circle, I've gotten 15, 20 calls about the same thing. So people are getting nervous, going back to what Rhonda said, speaking about food insecurity, and things like that. Folks are getting nervous, especially our seniors who are on, fixed and limited incomes, and the price of food has gone up, so when you got to make those hard decisions, like, do I want a red pepper or onion, or do I need to pay for my medication? Then you start getting into, sketchy areas. So I just wanted to make a point of that, so we can all kind of pay attention to what's going on with that food and that service. A lot of people are also saying that because the pandemic itself is kind of slowing down, and they're loosening protocols and so forth, that we're no longer in a state of emergency. So they're not going to be sending that much food and resources and so forth anymore. Not realizing that, like over here, the supermarket is closed. So what do you do? Right? So, just something to keep an eye on, and maybe shake the table if we have to.
Yeah.
But that's what I have.
Yeah, definitely. So, and with the programs and everything, I think that it's a great thing, something that we could discuss. I know that Mia, she have the contacts in the city, and then you have contacts. So, but we really have to look out for our seniors. And before I come to you, Warren, Barbara, what have you been doing at Ebbetsville apart from the soup kitchen or whatever? What help do you all want over there? What do you need over there?
Excuse me, Francesca, it's Warren.
Yes, I'm Warren.
Hi, I just want to chirp in on this subject. I just want to remind everybody that every Friday from 8 to 3, CB9 and Grow New York City has a fresh food stand in front of the Associated Market. And while we can't subsidize things in terms of giving away free food, because we have specific grants that are covering this, we do accept food stamps and WIT. And for the food stamps, for every $1 that you spend, you get another $1. So we're selling food at wholesale prices, and the people who are buying are getting 50% off. So in terms of Carroll Gardens, which is right near there, I encourage those people to come down because they'll get a very good value for their food stamp $1. And that applies to everybody on this call. We work very hard to get this food stand there, and we have a 3-year grant. So it's terrific food, fresh food, and we certainly could use all the support we get. Thank you.
Thank you much, Warren. I'll be right back. Let's keep the conversation going. I'll be right back.
Can I say something? I'm sorry. This is Barbara. I noticed the other day when I was on Nostrand Avenue, there's not a fruit stand from Lefferts all the way down to maybe almost Eastern Parkway on Nostrand Avenue. So, I don't know if anybody's aware of that. And the thing on Friday, I've gone there before. It is a good thing because I have purchased things there, but it's just amazing that there are no fruit stands. I don't know, for like 10 blocks.
I believe it.
Since the associate closed, where do you get vegetables and fruits from during the week? You got to come to all the way over here, to Western Beef or Food Town on Franklin. It's really kind of bad, especially for seniors, that have, problems walking or whatever, It's not good. Something needs to be done about that.
Hmm.
If it can, I don't know. But you
Yeah.
know, just speaking on
Yeah.
what I saw this Friday
I
when I
ag-
was around,
I agree with you, Barbara.
it's not good, you
Yeah.
know?
Yeah, I when I was at SUNY Downstate, I did a project on food insecurities in low income areas in New York City. That was my PowerPoint presentation. And I noticed accidentally stumbled across a national farmers market directory, which showed every active farmers market food stands in the United States. And I noticed in the 5 boroughs of New York City that the 5 boroughs, the areas where it has been gentrified or wealthy or better off, their farmers market is open year round on every Sunday or Saturday or Friday or whatever. But in the not so well off poor areas, that their farmers market or food stand operates at a certain point. It has an end date, and after November, December, whichever length of time that is, that's it. And I often wondered why.
Camelia, this is Warren. Our food stand, which is in front of the Associated, operates 12 months a year, so it's available to all. As far as from Lefferts down to whatever, if people have been shopping at the Associated, that's the purpose of this food stand. So you can disseminate that anybody who needs fresh fruits and vegetables, as you just said, every Friday in front of Associated, and we welcome all comers. So thank you.
Yes, and also Miss Love, I know that Diana Richardson, she's in charge. That is one on part of her portfolio, food insecurity. And I think I'm not certain if when you send out your emails, if you included her on the emails as well, because she was one of the persons involved in the associated closing down. And so she knows, and all of us know that she knows the what we're experiencing in the community. So we have to really stay on top of her, so that we can reach out, and help the persons in our community. Barbara, what I was asking earlier on is that for Ebbetsville, I have been trying to get into Ebbetsville for the longest while. I know for years I've been trying to speak to Miss Campbell. Sometimes when I do call her, she'll tell me she's in Vegas or she's in this place or she's on vacation or she'll tell me she was sick, so we've never been able to really meet, and get Ebbetsville involved and to find out exactly what's going on there with the funding for the seniors. And then I know that Department of Aging, I've had conversation with them when it comes to Ebbetsville as well as Fillmore Senior Center. But Ebbetsville was one of the senior centers that I have really been trying to get into, and I've not been able to have productive dialogue with the persons who are in charge over there. So I'm happy that you're here tonight, and I'm looking forward for us to be, to work together. And then because my next I'm coming to you soon. Is thing my next question, because stuff I had on my agenda, it's really outreach to the nursing homes, because I know during the pandemic, many of the nursing homes were closed. Some of them, they were receiving frozen food from Department of Aging, and then most of them, they didn't want it because of whatever their health issues are, and some of the food was frozen and some was too salty. And we know there were a few issues with some of them. I know when it comes to St. Gabriel, they were doing fine. Shalom, they were doing fine. Christopher Bledman, they were doing fine because they have the headquarters, another set of persons who I forget the names, that who's running the program. So they were doing okay. The foods were being distributed to them, but yet still, we have persons, especially we have recreational centers. We have seniors in our cities, in our community, who are not part or connected to a senior center, or they are not connected to a recreational center, and then we are not able to get to them, and then we are trying to really penetrate the apartment buildings. You know, we really want to get persons, and then we are trying to work with block association presidents who are able to connect us with those persons, because we know a lot of we know there are still senior centers, especially Fenimore. We know I need you to give me a little bit more on what's happening at Ebbetsfield, and then other seniors, other seniors in our community. The service that they are getting is not sufficient. They are not getting everything that's due to them, and we really want to get to the bottom of that. Miss Love, go ahead. Hi, Mr.
Well,
Almanac.
I
Welcome.
was gonna speak on the
Hi,
Ebbsfield.
welcome. Sorry being late. I just caught up in some earlier activity,
I
but
guess
I'm
I'll-
glad I'm able to catch you guys and join.
Okay. Go ahead, Barbara, and then
Okay.
Miss Love will come in.
All right. As far as our senior center, it is still closed. Management here has not afforded us the opportunity to reopen it. The person that's in charge, I don't know if she's doing anything. The president here has asked them, but they're not, a fan of our president, because she fights so hard for our rights here. And the lady that's in charge of it, I'm not sure what she's doing to get it up and going, because we distribute food out of there on Fridays, but it's not where people come in. We have a table right in front and we give it out, but the place is not even up to par to have seniors in there, And I was gonna mention also the food deliveries from city agencies. A few seniors in here don't like it, as you were saying, it's frozen or too salty. So what we do on Fridays, Beverly had I think that the mayor, the other mayor had some kind of program where you go to a restaurant, they're willing to be in the program. He paid them so much money to produce so many meals per week. And that's what we've been doing for the last year and a half, different restaurants, but the people seem to like that, but we only get like 250, maybe 300 meals a week. So it's not really a whole lot, but that's what I know. As far as the center is concerned, we would love to have it back open. I don't know if you know the one that was Oasis it was on Bedford down near Lincoln or something, Linden. That one closed. We had toured that one time before the pandemic, but now I see that it's closed. So I don't know. I don't know what else we can do, because management is not cooperating with us as far as getting it back in shape where we can open it up.
Yeah, and also I will have word with Karen, because if we can get, I know that Warren, Korean YC, they have the foods on Friday, but I know that they had a program, Karen, from the DA's office, they had a program where they I think once a month they were able to get fresh vegetables and fruits and stuff for persons, and they were free of charge. And it is something that we can look to see if we can have a distribution in our community, especially for the seniors.
We
So
do
it's
that
something
as
that we-
well. I'm sorry. We do that on the first Thursday every month. And then you also have Dolly, I'm not sure of her last name. She does two times a month. And
Okay.
it's on the patio, and Beverly does hers like in front of 11 McKeever. Anybody's welcome to come over. What we do, we did it today, fresh produce. I didn't go down,
Wonderful.
but we do have fresh
Wonderful.
produce.
Okay, so that's great.
so-
I'm happy to know that. That's great.
Are there any flyers or information that I can distribute to my parents or give to my parent coordinator, PTA president, so they can let families know about
As
these?
far as Ebbsfield's distributions?
Yes.
Well, the president, she usually sends out like she put flyers in the building, and everybody else around the area is like word of mouth, I believe, because she does emails to people that, that's on her email list. I don't know.
Was that Beverly?
Yes,
Beverly?
Beverly Newsom. Yeah, I think she's on the
Okay,
board.
so Beverly, so Beverly usually send it to the board as well, right? I know she
I
usually
can
send out
double
a
check.
notification.
I haven't seen a flyer in a while, but I'll reach out to Beverly offline
Okay.
and see if we can get a consistent flyer so that we can send it to, of course, the immediate school and the area, people in walking distance.
Right. Okay. that'd
A
be
lot
good.
of our families are reside in Edwardsville, so they may be aware of it, but then I would just like to get it out into the broader community.
Right. We do have people that come that's not in Evansville that come to the produce pantry. We do have people I know that don't live here. No, and they come over. So I don't know how far they are, but we do. I know there are some people that come in.
Okay, thank you.
Okay.
Thank you. Go ahead, Miss Love, and then after Miss Love, we'll hear from Mr. Almanar. Go ahead, Miss Love.
Okay.
It's
So
like 8 o'clock, so okay, go ahead.
I just wanted to respond when you asked if I was still in touch with Diana Richardson. I do include her on many of the emails, especially if, like I said, if we need to shake the table. But we do still continue to pick up we pick up our portion of food from LRBC, Lenox Road Baptist Church, on the 2nd and 4th Fridays of every month. And then that food is distributed to 600 Albany, that's that Kingston Senior Residence. We have 1055 St. John's and 230 Kingston Avenue, right? So we do that the 2nd and 4th Friday. With Mega Evers, we have pantry on the last Tuesday of every month from 3 to 5, right there on Crown between Bedford and Franklin. Also, we have a partnership with Mega Evers where we, go out and support the seniors. I just spoke to Ms. Dolly it's funny. I just spoke to Ms. Dolly the other day to check in and see, how things were going, if the center was open, what kind of supports that they needed. And, but we've done, pop-ups. I was just there. When was the last time I was there? December 28th, we did like a Kwanzaa giveaway. We gave out food and, personal care products and gift bags and things like that. So we're in touch with them, and we try to maintain that relationship. And when we do have the pantry at Mega Evers, we oftentimes walk bags over and have some of the volunteers bring the bags over so that the seniors don't have to come down the block to us. But we can try to see how we can work out. If you have one restaurant, Miss Barbara, one restaurant that you all are working with, I can probably connect and get some meals from another restaurant who I support with food and fresh produce, throughout the months. So we may be able to do something there.
Okay, I'll talk with Beverly about it tomorrow.
Okay.
See who she's working with now, because I know we've had like 4 or 5 different ones in the last year and a half. They contract usually lasts like, I think 8 weeks or something like that. And then if they're not able to continue, then we go to we find another. In the meantime, we're always looking for another restaurant. So I'll talk with Beverly. Jacqueline Love, is she able to contact you or correspond with you?
Yeah, she can.
Okay, I'll let her know.
Okay.
I'm sure she'll contact you through the board.
Or on Facebook. We're Facebook friends. So she can just,
Oh, okay.
jump in my inbox.
Write your name down so I don't forget, so she can talk with you about that. Okay, that's good. Sounds good. Thank you.
Oh, you're welcome.
Yeah. Mrs. Almanar?
Yes, last month in our meeting of the Park Agriculture, we've been working with the community garden. Maple Street Community Garden does have a food distribution. Miss Brenda Hawkins-Pagan is in charge of that. And she works with one of the union, and they usually will have bags of produce ready to distribute to the community. I think we should reach out to her that they're about to start the season. Not only during they get stuff from the union to give to the members, they usually will have extra bag to give to the rest of the community. So we should, at our meeting next week, I'm going to talk to her about that to see the possibility of extending some of the stuff they are doing. So they do the distribution right at the community garden right there on Maple Street.
Can you give us her names of those other persons who need to get that information? Her
Yes.
name and the exact address, please?
Yeah, I'll give you the names of Brenda and the other person that was for the community garden, because they came and did a presentation of what's happening in terms of that, in terms of green spaces, and this is one of the activities they do, the food distribution. Especially after the harvest, whatever they harvested at the end of the season, they usually create bags to give out to the community. Okay?
Okay, okay,
So I'll
thank
forward
you.
that, I'll forward that information. I think I'll forward it to the board also, if you get a chance to watch last month's meeting, some of that information is right in there also, okay?
Okay, thank you, Mr. Ahmad. And so Barbara and Rhonda, whatever information, whatever help you need, please reach out to the board. And then I'll throw out my number because we don't have a chat, so I'll throw out my number so you can call me directly if you wish. But if you need to get, you can, whatever information or if you want to pass on anything to me, the board, they're really good. They would always send me a text message, an email, and let me know this person is trying to reach me and this is what it is. And then I'll get right to you. So, but my telephone number, direct number is 917-763-9284. That's 917-763-9284. So as I said, I don't have to plan for the quarter. We have Rhonda that we will be working with you. We'll also be collaborating with Miss Love with initiative coming up at the Crowns Gardens. And just let us know, because this is what we are there for, to help, to serve the community. So please let us know what's happening. Any complaints that you hear, just call the board, and Mia will contact any of the committees, to reach out in any way that we can help. Mr. Almanara is the chair for parks, so whatever it is, you have a question, any issues or anything, please contact us. And then I'm looking forward for us to work together. And Ms. Rhonda, I'm looking forward for you to hear you so we could sit down and get things going. And as you said, whatever resources that we have, and I don't know as to how many people you have on the panel, but then on my side, I know that we can have persons coming in, since it will be one thing I don't like. Even with my job, I tell my commissioner, and whenever they talk about link, I don't like to give people a link and say, okay, we're gonna put a link in the chat for you and then go. It just don't work. One person said goodbye, they forget the link. Because some persons, they don't sit down and write links. More or less, they would write a telephone number, and you could say, okay, call Kingsbrook and ask for Enid Dillard. This is a telephone number. People would they would do that. Then you tell them this is a link and go and research for information. So I always like that in-person thing, that I can give you a piece of paper, we can talk, and I like that, but we don't have a choice right now, so we're doing virtual. But I like to know that persons have a name that they can call and say, I'm going to call John Brown, I'm going to call Francisca Leopold and ask for that person, and get the information. And if that person don't have the information to give, they can refer you to somebody else. But at least there is some hope, and they're looking forward for something happening for them. So I'm looking forward to us working. I know Enid is sitting there, so she heard what you said. So I know that she will start working on her side as to, whatever that she can come up with, and provide whatever service that she could provide from her end and from my end as well. And I'm looking forward for us to work together. As all of us here collectively, each person brings their own ideas to the table, and we put it together, and everything that we do, we're doing it with open heart. We're here to serve the community. And anyone who's interested in the seniors and the wellness of the community, the committee is open to the public. You could invite anyone. And Ms. Rhonda, I'm hoping after us working together that it won't be the last, that we will see you. You'll continue coming, as well as Barbara. Barbara, you come in, I'm looking forward to working with the seniors, whatever information you have, whatever needs or whatever we can do together. I'm looking forward to it. Okay?
All right.
Yes.
So for the rest of the team, I thank you so much for your time. I thank you for being here. As always, blessings. Great work. I'm looking forward to see you next month, but most likely maybe before then, because we may get an email that we may have to meet to reconvene so that we can go over the discussion and the series that's coming up for Miss Rhonda for the school. Okay, have a blessed night. Stay safe, everyone. The meeting is adjourned. It's 8:10.
Good night.
So much. Good night. Very
Good
informative.
night, everyone.
Good night,
Good
everyone.
night, everyone.
Bye.
Good
Thank
night,
you.
everyone.
So
Take
much.
care.
Thanks, everyone. Stay safe, everyone.
Yes.
Bye-bye.